We will now begin today's webinar. This webinar is being recorded so that those not able to join us today can listen to this program at a time that is convenient for them. A link to the recording and the presentation will be included in an email to everyone who registered for this event. The email will be sent in the next few days. My name is Katie Ramos, and I am the Program Associate for Goodwin House at Home. It is my pleasure to introduce your program moderator, Lauren Bradley, a master level social worker and one of 3 member services facilitators at Goodwin House at Home. Welcome, Lauren.
Oh, thank you, Katie, and welcome everyone. So as Katie mentioned, I am one of the member services facilitators with Goodwin House at Home, a role I began in January. Previously, I worked for Amazing Place, a phenomenal organization in Houston, Texas, serving persons with dementia as well as their family caregivers. So it's been an absolute joy to work for Goodwin House at Home, another phenomenal organization that really strives for excellence, especially during this odd time that we're in. So thank you for joining us today to gain insights on how you can stay safe, healthy, and engaged during the upcoming fall and winter seasons amidst the coronavirus pandemic. I am pleased to be your moderator. America is now in month 8 of the pandemic. We are grateful for the continued progress that is being achieved to understand the virus and keep people safe. At the same time, we know that while we may be done with the COVID-19, it is not done with us. Progress continues to be made on vaccines. We know we will need to continue to follow safety guidelines and health recommendations until a vaccine has been developed and likely longer. We're pleased to provide today's program, Staying Safe This Fall and Winter. And now for a few housekeeping notes. You will see the PowerPoint slides and our featured expert on your computer screen. You may want to adjust the volume on your computer if you're having trouble hearing me or our featured expert. We have allowed time for questions and answers following the presentation. Let me explain how you can pose questions using the chat function. Feel free to enter a question in your question pane at any time during the webinar. This slide provides visual instructions on how to do that. I will give you a minute to review it. Let's review how we'll cover this topic for the next 60 minutes. First, we'll hear from Lindsay Hutter, our Chief Strategy and Marketing Officer, who will give an overview of Goodwin House Incorporated. Next, we'll hear from Dr. Maggie Gloria, Medical Director of Goodwin House Hospice. She's going to talk to us about staying well this fall and winter. And we'll conclude with questions and answers from the audience. It is now my pleasure to introduce Lindsay Hutter. Lindsay is a daughter, sister, aunt, and friend. Then she is a Chief Strategy and Marketing Officer. The order is intentional for her, as she believes that aging well is a family affair. Each generation, from young to old, support, honor, and uplift one another. Lindsay Hutter leads strategic efforts to fulfill and expand the Goodwin House mission. Lindsay also oversees Goodwin House branding, marketing, sales, and communication efforts, ensuring current and future residents, members, employees, and guests feel warmly welcomed and well informed, and that the organization meets its growth and revenue goals. She holds a BS in journalism and mass communications from the University of Kansas and a master's in political science from Northwestern University. She serves on a number of nonprofit boards and communities in Northern Virginia. Welcome, Lindsay.
Lauren, thank you so much, and thank you to our Priority Club members and our Goodwin House at Home members for making this investment of time to be with us today. I know that many of you are familiar with Goodwin House at Home, or possibly our Life Plan communities, Goodwin House Alexandria and Goodwin House Bailey's Crossroads. I want to take a moment to share with you a little bit more about each of those programs and also about the healthcare services that are part of the Goodwin House family. And the reason I think it's important to do this is so you have a full view into the range of professionals that uphold the Goodwin House mission to support, honor, and uplift the lives of older adults and those who care for them. That is especially important in this unprecedented pandemic. So for a second, let me just outline who are the types of professionals that are part of this organization. They are medical directors, such as Dr. Gloria. They are life enrichment professionals. They are wellness and fitness professionals. They are arts and culture professionals. They are dining and nutrition experts. They are home health therapists and hospice nurses. These experts all bring their knowledge to the older adults that are served by Goodwin House Incorporated. And all told, Goodwin House serves over 2,000 older adults across Northern Virginia. So how do we do that? On the slide that you see before you, featured are two of our service lines. One, Goodwin House at Home, and the other are two Life Plan communities. Goodwin House at Home is a product that makes it possible for older adults to age in place the way they want to age in their homes. Our two Life Plan communities, based in Alexandria and Bailey's Crossroads, allow you to move into a community and live with others and forego whatever are the responsibilities that you may have in a home. Now, the good news about Goodwin House is that we make it possible for older adults to do both. Some older adults want to live in their homes as long as they can, and then they may make a decision that community life is for them. And we welcome them into one of the Goodwin House Life Plan communities. So the great thing about joining Goodwin House is you don't have to make a choice about where you live. So as we flip to the next slide, what you will see are healthcare services that we provide older adults. Goodwin House is unique in that we have quite a number of healthcare services that we bring to older adults. What you see on the far left of the screen is Goodwin House Home Care. This is private duty home care that is available to our residents in our two communities. In the middle, you see Goodwin House Rehabilitation Services and Home Health. These are therapy and rehab services that we make available to our residents and that we also make available to older adults who maybe have had a surgery and want to recover and undergo their therapy at home. Could be that that's a Goodwin House at Home member or a Priority Club member that has had some type of some type of surgery and needs therapy at home. We can provide that service. We also provide these services to other senior living communities and their residents when those communities do not own and operate healthcare services. And finally, we have Goodwin House Palliative Care and Hospice. These are services we provide to our residents, and our hospice is a service that we take out to older adults across Northern Virginia in their homes or in other senior living communities. The reason I wanted you to see this is so you realize that when you joined Goodwin House, when you become part of the Goodwin House family, you have a full and integrated suite of healthcare services to keep you well and thriving. So let's step into the next slide and talk about Goodwin House Incorporated's approach to the pandemic. Thus far in 2020, Goodwin House has invested over $5 million to keep our residents, members, and staff safe and healthy during the pandemic. And what this slide captures is the three-pronged approach and philosophy that has guided Goodwin House. We're guided by a leadership focus, we're proactive, and we have a mission mindset. So how does this translate? In terms of the leadership focus, we began our efforts around the pandemic in late February. We established an infection precaution and planning team, and that planning team met daily during the first 4 months of the pandemic. We now meet several times a week, and our total focus is how to keep our residents, our members, and our staff safe. What you see in the photograph, and you might recognize her, that's Lauren, our moderator, is how we pivoted to virtual programming for our residents and our members starting in March, because we knew that isolation was going to be a challenge in the pandemic. And so we've actually had over 1,500 virtual programs that have been delivered to our residents and our members since the pandemic began. Now, in the middle, you see proactive approach. That's the second prong of our philosophy with respect to keeping our members, our residents, and our staff safe. And what that means is that very early on, Goodwin House, as far back as April, sought to establish relationships with testing labs. We were among the first senior living organizations to begin proactively testing our residents and our staff, and that was in May. And we have conducted over 9,000 tests since then. We are now engaging in antibody testing, and we use that to capture those asymptomatic cases that you've heard about if someone might be showing symptoms. That gives us a rapid turnaround in terms of the results. That's just one way that Goodwin House has been proactive. And then on the far right, you see mission mindset. Having been on the front lines of this pandemic for 8 months, in August, we realized that there was a lot that we had learned, a lot of tools that we had developed to help our organization, and that those tools could be shared with other organizations around Northern Virginia. You see our playbook. That was a playbook that we published in late August, and we said, let's take all of our tools and our resources and share them with churches, with schools, with small businesses. To date, we know that over 300 organizations now across the country have downloaded this playbook and are using the playbook. We want others to be able to resume life as normal as it can be and do so safely. So what do the numbers look like actually? How do we take the leadership focus? How do we take our proactive approach and our mission mindset and put those into action? Well, the first thing I want to go back to and talk about are the tests. As I said, my numbers are updated because we do tests twice a week in some cases and weekly in other cases. Over 9,700 tests of residents, staff, and hospice patients since May. Now, I mentioned that we're proactive. We developed relationships with 4 different labs because if something happened with one of the labs, we wanted to have backup relationships in place. I also mentioned that we've shared our resources with other organizations, and we've done so at absolutely no cost. This is a mission mindset. Together, we're stronger. And so we've actually conducted hospice tests, about 300 for other organizations, a number of schools actually here in the Northern Virginia region. We also have engaged in group buys for PPE. We realized back in March that as one small regional organization, we were not going to be able to command attention in the global markets for PPE when it was in such demand. So we arranged for a group buy. We invited over 50 organizations to join us so we could buy in the hundreds of thousands, and we did. And so you see to date, we've helped 65 other organizations receive PPE at significant discounts. All told, we have purchased over 950,000 pieces of PPE since the pandemic began. And then finally, I mentioned that we pivoted very quickly to go virtual and have conducted over 1,500 different types of virtual programs for our Goodwin House at Home members, for our residents, and our Priority Club members. So let me take the translation one step further and say, how have all these efforts helped keep COVID at bay in our communities? This next slide is going to show you what our COVID case count has been since the beginning of the pandemic. And you'll see that at Goodwin House Alexandria, we've had 5 residents test positive and 34 staff members. At Goodwin House Bailey's Crossroads, 11 residents and 29 staff members. We sadly have lost 3 residents due to complications with COVID. We are a family and we mourn them and we miss them. And what I would say is that no organization and no family in this country or in this world has been immune from the tragedies that COVID has brought to us. You'll also see here that we've included what's been the situation with Goodwin House at Home in positive cases for our members and our staff. Delighted to say no members have been tested positive, nor have any staff. You'll see in the Goodwin House Hospice column that 40 non-Goodwin House residents that we've served across Northern Virginia have had COVID. What this demonstrates is an organization that is not afraid to step in and serve when it's difficult and it's challenging. We've also had 4 members who are served by our Goodwin House Home Health Program who live outside of our communities test positive, and we observe them. So that is a little bit of an example of what it looks like in terms of our case count. So as we move to the next slide, this is going to show you one example of our PPE group eyes. Featured on the left side of the photo is Lisa Wallace. She's our Corporate Director of Supply Chain and Procurement. Next to Lisa is the Reverend Marcia Norfleet, who is a pastor at Alfred Street Baptist Church, an historically Black church in Alexandria, Virginia. Alfred Street Baptist Church is just one of many organizations that we helped obtain that PPE. Again, Goodwin House is bound by a mission mindset. And when you join a senior living organization, you want to know as much about what are the healthcare services, if it's an at-home program, what type of benefits, or if it's a community, what about the programming, the dining services, and the activities. I think you also want to know about the heart and soul of an organization. And our mission mindset is at the heart and soul of Goodwin House. Now, as we shift to the next slide, what we're going to show you is our COVID landing page on our website. And just as I've been very transparent with you about our investment, our efforts, our case count to date, I want you to know that we're equally transparent in our public communications. So if you were to visit our website at goodwinhouse.org, at the very top of the home page, you'd see a COVID landing page. Click here, and you go there, and you will see our situation and all the updates that we publish on a weekly basis to our residents and to the family members and loved ones of our residents. Now, just as we want to be transparent about our situation, we also want to be sharing with our resources. So as we go to the next slide, what you'll see is that you can go to that landing page and you can access programming guides, activity guides, information on how to stay safe during the fall and the winter. You can view past webinars. You can view the playbook. It's all there. So that gives you a glimpse as to our leadership focus, our proactive approach, and our mission mindset to COVID. And I believe that that is the last slide that I'm responsible for in this. And that brings me to an introduction that I am so incredibly pleased to make. I feel like I've been a little bit of the warm-up in this, and now you're going to get the main act. So it is my pleasure to introduce Dr. Margaret Gloria. Dr. Gloria serves as a member of our Infection Precaution and Planning Leadership Team. You will find her to be a calm, thoughtful voice on the coronavirus, and we are grateful for her daily wisdom to inform our safety protocols and those efforts which allow our residents to see their loved ones and engage in as much community life as is safely possible. Dr. Gloria completed her fellowship training in hospice and palliative medicine, as well as internal medicine at George Washington University. She is board certified in internal medicine and hospice and palliative medicine by the American Board of Internal Medicine. Dr. Gloria proceeded a step beyond that internal medicine certification to earn the HMCD in order to become a hospice medical director, a certified hospice medical director. Prior to joining Goodwin House Incorporated, Dr. Gloria served on the inpatient palliative care team at George Washington University Hospital. Welcome, Dr. Gloria.
Thank you, as always, Lindsay, for such a warm welcome, and welcome everyone to the webinar. I'm so glad that you could join us again. I thought that we could start out by talking again about what we've learned since March, since the start of this pandemic. So during the presentation, I'm going to talk about what was once trial treatments are now becoming more the standards of care. We're going to talk about how basic infection control precautions are working. We know it's working, and I'll show you that. We're going to talk about vaccine trials and where we are as far as that. They're promising, and so far they've been rigorous. And then we're going to talk about, knowing the likelihood of a fall and winter surge. We've talked about that during previous webinars, so we'll get back to that topic again, okay? So on that note, I'm going to sprinkle a little bit of a personal reflection in here. And I wanted to talk just a little bit about what I've personally learned since March, since we started on this pandemic adventure, if you will. I know that I initially started out thinking, when this is over, when this is over. And since I've really focused and shifted my focus on how we are going to live with this for the long term, because I do think that even after we have a vaccine, COVID is still going to be very much a part of our lives. I think it's going to be like the flu. It's not the flu, unfortunately. It's worse than the flu, but it's going to be like the flu in the sense that it's going to be something that we think about with some seasonality, and we're going to have to know our risks and know how to minimize them. So kind of keeping in mind the mind frame, this is going to be a marathon and not a sprint. And I think we've all experienced that already in the past 8 months, right? So let's kind of review a little bit the state of the pandemic. We'll start globally. This is again a graphic from the New York Times. I've mentioned in previous webinars, they're offering all of their COVID coverage right now for free to the general public. So even if you are, don't subscribe to the New York Times, you can log in and access any of these graphics. This is a representation of the globe, and each color represents the number of cases per 100,000 people. So it's adjusted for population. The lighter yellow colors are where the numbers are lower, so less than 2 per 100,000 positive cases, and the red, going all the way through the rainbow to the red, which is where the cases are more prevalent. Okay, so let's look at the US specifically. Okay, so on the left-hand side here, you'll see a graph which we've looked at in previous webinars. This represents the number of new cases reported each day in the United States as a whole. The dark red line along the top of the graph represents the 7-day rolling average of number of cases. And we can see if we look at the graph, there's a little spike in the springtime. That was that first wave that we all experienced. And then it kind of came down a little bit. And then we actually had a second wave in July and August, which honestly, I don't think we really felt as much in this part of the country, but it was experienced in other parts of the country. It was actually a bigger wave than even the first one in the spring. But again, I don't think that was really evident to us here in this area of the country. And then the cases started to drop again. And now over the past several weeks, you can see that the number of cases is on the increase again. Again, this is that fall wave that we were expecting was coming. If you look at the graph on the right-hand side, that's the map of the US, that actually kind of represents where the cases are, where they're seeing more and more cases. And as you can see, again, it's the same as the previous graphic. The yellow is where they're seeing fewer and the red is where they're seeing more. You can see really concentrated more kind of in the Midwest of the United States is where they're really struggling with a lot of new cases. So there have been a total of about 8.2 million cases total in the US to date. A little over 220,000 deaths attributed to COVID-19. So let's look more specifically at Virginia. So this graph represents, this is from the Virginia Department of Health, and it represents the total number of cases reported each day for the entire state of Virginia. So if you look, same kind of concept, the blue lines are the total number of cases, that dark yellow line is the rolling 7-day average number of cases. You can see again, we had that spike in the spring, and then the number of cases dropped, and then there was a second spike that's come into the fall. So let's look at our area specifically on the next slide in Northern Virginia. So again, look at that bigger graph on the left-hand side. There's that spike in the spring, but after that, say about June 14th, I can see on this grid, our case level has actually been quite stable. You can see there's kind of little ups and downs here, but it really hasn't budged much. If you look at the smaller graph on the right-hand side, that represents all of Virginia excluding the northern part, so excluding us. You can see again they had that little spike in the spring, probably less so than we did. But since then, again, starting about 4th of July, they've really had an increase in cases. So what we're seeing here is, although in other areas of the country and even in other areas of the state of Virginia, cases are increasing, we're actually staying quite stable here in our area, which is great news. And that leads me to my next point, which is very important. What we're doing is working. So keeping, washing your hands, social distancing, covering your face, not touching your face when you're in public, knowing that any environment that's enclosed, where you're going to be in tight spaces with poor air circulation around other people, that's going to be high risk. And of course, I think it's probably lower risk, but those surfaces, you're thinking about making sure that the doorknobs, the steering wheels, food packaging, your cell phone, all those things could possibly be vectors for transmitting COVID-19. So I think it's clear in the graphs, we're doing everything right, and we've kept our number of cases pretty steady. And so I think that's really great news, and we should be proud of that. So let's talk about treatment updates. So in previous webinars, I've mentioned remdesivir was a trial drug. It was originally developed to treat Ebola. And since having emergency use authorization to treat COVID-19, it's actually been continuing to prove itself as effective. So that's been great. This is exactly what I referenced earlier. What was once an experimental treatment is now more and more becoming the standard of care. Regeneron, that's a company, they have a new antibody that's called REGEN-COV2, and it's actually a manufactured antibody that they make in a lab. This is actually all of these treatments, but that's one of the treatments that President Trump received, actually, if you saw that in the news. They are still using convalescent plasma, which is the same concept, except instead of making the antibody in the lab, they actually take the antibody from somebody who's already recovered from COVID-19. They spin it down and separate it out and then give it back to somebody who's gravely ill with COVID-19. Both of those methods of providing antibody treatment to people are proving time and time again to be helpful, so that's great. And then dexamethasone, again, we talked about that at the last webinar. There was some data that initially came out of the United Kingdom that dexamethasone was helpful in severe COVID-19 infections, and it's just continuing to prove to be the case. So we have at least 3 very solid treatments for COVID-19, which is really great news. And accordingly, we've seen the mortality rate decrease over time. So that's also great news. That's actually one of the things, going back to the graphs we were looking at earlier. I always like to mention to people, sometimes looking at those graphs where you're seeing these curves, it can look and it can feel very ominous because it feels like, whoa, that is a lot of infections. But you have to keep in mind that actually the vast majority of people that are under the area of that curve have recovered already. And so now even more so that our mortality rate is dropping. So that's really good. Okay, so let's talk about the vaccine updates. Yeah, perfect. So this graphic that you see on the right side that has the coronavirus tracker, that's also from the New York Times. I had to update this even just yesterday because every day it changes. Every day more and more vaccines are entering, certain different phases of clinical trials. As of October 16th, there are 31 that are in phase 1 trials, 15 in phase 2 trials, 11 that are in phase 3 trials, and 6 in Russia and China have been approved for limited use already. There haven't been any that have been broadly approved for mass distribution, but we're getting pretty close. I listed out a couple of specific vaccines that are of note for us because they're companies that are here either in the US and Canada or the UK, and they're companies that the federal government has already tried to start making contracts with to start distributing the vaccine once they have it developed. The first one is AstraZeneca. We've talked about AstraZeneca before, I think, in previous webinars. They are running a phase 2-3 combined trial right now in conjunction with Oxford University. Their trial, if you noticed in the news, was actually stopped on September 6th because there was a participant that had an adverse reaction. It has since been restarted in the UK arm. It has not been restarted yet in the US, and that's just because the FDA has such stringent protocols for running trials of anything, vaccines included. So what they're going to do is continue the arm in the UK, and when they've collected a little bit more data and they feel that it's safe, they'll restart the arm here in the US and continue moving forward. Each of these vaccines is a little bit different in how it's made. This particular vaccine uses a viral vector, so that means they take a different virus that's harmless, like an adenovirus, for example, and then they genetically incorporate some of that genetic material from SARS-CoV-2 into the adenovirus so that it is still harmless, but your body picks it up as being foreign and makes antibodies specifically to COVID-19. The next one I'm going to talk about is Moderna. They are in the middle of a phase 3 trial in conjunction with the NIH. Their vaccine is genetic. So meaning that it's not an actual virus that carries the genetic material, it's just the genetic material alone. It gets administered to study participants, and then their body sees it as being foreign genetic material and builds an immune response to it. That has not been paused, and so far the data on that is looking pretty good. Johnson & Johnson, they're in a phase 3 trial. Theirs is also a viral vector, so just like AstraZeneca. Theirs was actually paused on October 12th. It's unclear though, there was an adverse reaction in one of the participants. It's unclear that that person even got the vaccine though, so it's still too early to kind of know much about that. But as is the way that these things function, it's been paused until they can gather more data. Of note, the most recent vaccine in modern history that has been developed this rapidly was the Ebola vaccine, and it was actually Johnson & Johnson that developed the Ebola vaccine, so we'll have to see. And then Pfizer is on our list. They are in phase 2/3 trials. So that means basically that they've combined their phase 2 and their phase 3 trial, and they'll report all the data together. That one's also a genetic vaccine. And then Novavax I added on the list because it is a company that's based out of Maryland, so very close to us. They're in phase 3 trials. They have a whole different type of vaccine that actually just includes a piece of the protein from the virus. So no genetic material at all, just a piece of the protein. And so same kind of concept. Your immune system would recognize that protein as being foreign and would make an antibody to it, therefore making you immune to COVID-19. I did want to just plug real quick, there is one vaccine out there that is FDA approved, has tons of data to support its safety and efficacy, and that is the flu vaccine. So don't forget this season to get out there and get your flu vaccine. It's more important than ever because you don't want to get the flu, you don't want to have to go to the doctor, you don't want to have to go to the hospital and increase your risk of being exposed to COVID-19. So now while it's early, get out there and get your flu vaccine. And then just so that we're all kind of keeping in mind, even though these trials have not been completed and these vaccines have not been approved, the process in the US is quite stringent. The CMS, the CDC, and all of the entities that are involved in this kind of a thing are all already working to plan to have protocols and programs for distributing the vaccine. And they've said that they're really going to focus on trying to get the vaccine to the highest risk groups first. So that would be really great to see. That would be my patient demographic, basically. Okay, so last but not least, let's talk about some of the testing updates that we have. So PCR remains the gold standard in testing. That can be done either by collecting a saliva sample, by collecting a Q-tip from the nose, or by doing the dreaded nasopharyngeal swab, which is when they stick the swab all the way back in. Basically, the way that those tests work is that it takes that sample and it amplifies it and it looks for viral genetic material. So it's kind of like a crime scene. If your DNA is there, it's going to be very hard to prove that you weren't there. If the viral DNA is there, it's hard to prove that that's not COVID-19. They're very accurate tests. We still have antibody tests available. They're not as helpful right now in the current arena because they reflect more past infection. But as we start to see more and more people with herd immunity, we have a vaccine, those tests may come into play and be more and more important, but they're available. So that's great. We have the tests that work and they're there if we need them in the future. The newest, latest, greatest news in testing is actually the antigen tests. So these tests do not look for genetic material, they look for proteins that come on the virus. Most of the tests right now are run with a little machine, but they can be run even in smaller laboratories and in places like nursing homes and assisted living facilities. Some of these companies are actually making new antigen tests that don't need a machine at all. So imagine a test for COVID-19 that you could run at home with no machine or special equipment, kind of similar to the way that pregnancy tests function now. All you would need is a sample and a couple of drops of reagent, 15 minutes, and you have your result. So these tests are not as accurate as PCR testing. The sensitivity is a little bit less. But a lot of the experts that really believe in these tests argue that a little bit of give in the sensitivity is well worth the convenience of being able to have, readily available COVID-19 tests. That you can imagine someday you could just go to the drugstore and buy a box of tests and have them in your home if you needed to test them. We are not there yet. There are only actually 2 that are available on the market right now that function like that. One is the Abbott Binax Now. That has been basically bought up by CMS because that's the Centers for Medicare and Medicaid Services. The government has purchased those all up already because they're providing them to nursing homes and assisted living facilities so that the people that are at the most risk can have access to those tests. The second company actually just got their approval yesterday. So I think in the next coming weeks, we're going to start to see the availability of these tests, and the manufacturing and all of that is really going to ramp up, and they're going to be absolutely priceless in our battle against COVID-19. Okay, so where can you get tested? I think that's a really important thing to cover because I get asked a lot, where can I get tested? So I wanted to include a slide so that you all can kind of have that information. The first two bullet points on the slide, you'll see McLean Pharmacy and Preston's Pharmacy in Arlington. Those two do not require a doctor's order, and you do not have to meet any specific criteria. So for example, if I have a patient that knows they're going to go see their family on Thanksgiving and they would really feel better if they had a COVID-19 test before they go, I would direct them to one of these two places. Most of the time they can bill your insurance, and if not, you pay out of pocket. The tests are about $125 each, depending on where you go and the time frame that you need the results back by. So those are very, very important to have. CVS and also your local healthcare departments, they can certainly help you get tested, but you have to meet specific criteria. So you can't go to a CVS if you don't have symptoms or if you don't have a known exposure, but you can still get tested. I have said from the beginning, and I still say today, the best way to get tested, the best place to start is with your primary care provider, because your primary care provider might have contracted with somebody that can help you get tested, or they might even be able to do it themselves. So start with them. And if you run into issue there, then at least you know you have a couple of other resources available. One last thing I wanted to mention about tests. Some of these newer tests that are being developed that are run in labs, so not at home, but in the laboratories, are combining testing for the flu, COVID-19, and lots of other respiratory infections so that we can run them all at the same time. So that's going to be really helpful and useful this fall season. We're very excited about that. Okay, so let's pivot a little bit, and we're going to talk about how to safely approach the upcoming holiday season. These recommendations I took directly from the CDC's website. I didn't change any of the wording because I didn't want to dilute their message, but I'll go through each bullet point. We'll talk a little bit about each. So the first one is community levels of COVID-19. So when you're thinking about a holiday gathering and you're considering whether or not you would want to go, one of the things that the CDC wants you to think about is what is the rate of community spread in that area, in your area, or I'll get to a later bullet point, in the area where other people are coming from. So what does that mean exactly? You've probably heard the term case positivity rate mentioned in the media. That means basically for every COVID test that we're doing, how many people are coming up positive? I will tell you that right now in Fairfax and Arlington counties, the rate is less than 5%, which is absolutely what we want to see. That's perfect. Alexandria is a little bit trickier because they report their data by zip code, and so it's quite variable. Some zip codes are, the case positivity rate is 1%, and some zip codes it's as much as 20%. So what I recommend is that you go to the website for your local health department and look exactly at what the case positivity rate is being reported, okay? And then the other thing to consider is the location of the gathering. So is it going to be inside? Is it going to be outdoors? Obviously, a gathering that's inside in a closed space with little ventilation is going to be much higher risk than a gathering that's outside, for example. The other thing to consider, the duration of the gathering. So the longer you are around other people sharing air, the more risk you're going to have. So is this going to be a 10-minute thing, a half-hour thing, a 2-hour thing? It's something to consider when you're weighing the risk. The other thing is the number of people that are going to be there at the gathering. You know, in the era of COVID-19, if you get invited to a gathering, I think it's perfectly acceptable to ask these kinds of questions. Where exactly is it going to be? Exactly how many people are going to be there? We all know the more people, the more risk. And then the other thing is, where are people coming from? I think it's perfectly, appropriate to say, is everyone going to come from locally, or do we have people that are coming from potentially other areas where the case positivity rate may be a lot higher? Something to consider. One thing is, if you know the behaviors of the attendees prior to the gathering, so let's just say you have a set of in-laws that have bucked any kind of infection precautions, that may not be the best place to spend the holidays. The other thing that the CDC wants you to think about is the behaviors of the attendees at the gathering. So are people going to be eating? Because you have to pull your mask down to eat, of course. Are people going to be raising their voice, yelling, talking, laughing, singing? Those things all increase your risk. And then the other thing I didn't include on the slide, but I've seen often, is to consider the behavior after the gathering. So let's just say, for example, you've been invited to a holiday gathering that you'd really like to attend. You recognize there's some risk, but you really want to go. Think about, do you have the time to quarantine for 10 days afterward? Because that's really the recommendation. So that just in case you get exposed to something, you're not further exposing more people when you get home. So you kind of have to weigh all these things. And on that note, I wanted to close talking about a really important topic, and that is the social isolation that I think we're all experiencing as a result of this pandemic. This is just a couple of snips of articles that have been written, but there's a plethora of information about specifically how social isolation that's been a result of COVID-19 has affected the elderly population. I see it in my patients anecdotally, I see it in my family, and we see it in the literature out there in the medical community. It has been, in the words of my mother-in-law, devastating, for a lot of people. So as much as I am a proponent of safety and making safe decisions, I want to keep talking a little bit about how we weigh, which is actually going to bring it home, bring it on to the next slide, how we weigh the decisions that we make about being safe and also protecting, our sanity and our quality of life. So another personal reflection to toss in here for you. This is my family. These are my in-laws and my oldest son. When my kids were born, my in-laws came right away, and they have been an integral part of my kids' life. And I mean, they've raised my kids. I have to be honest. They're wonderful. And being separated from them during the pandemic has really, really taken a toll. So as a family, we've made some decisions about how we're going to spend our holiday gatherings, and even actually moving in, as a multi-generational home in the near future. That's based on our quality of life and what's important to us, and where we fall on the spectrum of risk. Some people are very risk adverse. They don't want to take any chances, and that is perfectly fine. Some people take all the risk. That's fine too. I think most of us are somewhere in between. So my hope is that you can use the information that I presented to you in the webinar today to try and make educated decisions for yourself based on your level of comfort and based on what is quality of life to you. That's all I've got.
Thank you, Dr. Gloria. We're going to move into our Q&A now. The next slide will show you also how to pose a question. We have a few questions that have already come through. I think this first one would be good for you, Dr. Gloria. You mentioned the importance of getting the flu vaccine, but what about the pneumonia vaccine?
Oh, that is an excellent question. Equally important. So not every single person is a candidate for the pneumonia vaccine, but if you qualify, absolutely recommend that.
Next question. Someone says, I have read that we are beginning to see people who are reinfected. What does this say about the possibility of immunity?
Yes, that's an excellent question also. And that kind of goes back to the paradigm shift from, when is this going to be over, to this is a marathon and not a sprint. This is going to be with us for a long time. So the data that we have so far is showing that immunity only lasts for 3 months. So the going thought is that even when we develop a vaccine, it's going to need to be boosted. Time will tell how often we're going to need to booster the vaccine. It may be like the flu vaccine where we booster it yearly. Worst case scenario, it may be something that we need to booster every 3 months or so.
Another question is about testing. So for you, Dr. Gloria, Quest Labs offers a test kit that they send to your home. How do you feel about the accuracy of these tests?
That's an excellent question. You all always have the most excellent questions. That depends on the type of test. So if it's a PCR test, I would say I trust that they're pretty darn reliable. If it's an antigen test, I think you should work with your primary care provider to decide whether or not that is sensitive enough for your purposes.
A couple more questions are coming in. Give me just a second.
I will say, I do think that most of the tests that are available at home today are PCR based. So they're looking for the virus's genetic material. And in that case, Like I said, I think those are pretty darn reliable. The antigen tests just aren't quite as widely available yet. So if you forced me to guess, I'd guess that what Quest is using is probably a PCR test. But again, I'd recommend you follow up with your primary care provider.
And going back to the flu vaccine, someone wants to know if they had the flu vaccine, say in early August, would I need to get an additional shot to last the entire flu season?
No, as long as that was this year's flu vaccine, you should be fine for the whole flu season. Which actually goes, as I'm sure you're all aware, well through the spring. So
another question about testing. Do you recommend that members of my, and this is in quotes, pod, get regularly?
So I'm really glad that you mentioned the pod, because that's yet another concept that people are coming up with. I almost referenced it with my own family and I didn't use the term pod, but that's one way that people are safely approaching the need to try and balance this risk of social isolation with, the precautions that we need to take with COVID-19. I think the answer to your test or to your question kind of depends on who's in your pod. So if you have, for example, a healthcare worker in your pod, that person would ideally be tested fairly regularly for COVID-19, with the caveat that we still are really actually short on widely available tests. At some point in the near future, my hope is that, like I said, these tests are available at the drugstore. And in that case, if you have somebody who is high risk in your pod, then I would say, yes, that would be ideal. If you can test, on a regular basis, then you should. Right now, for the average person, the tests just are not that widely available. So I don't think that's going to be an option for most people.
Thank you. So this, I think, probably is a question for you, Lindsay. When a vaccine is available, will Goodwin House residents be among the first to receive the vaccine when it's available?
That's a great question, and I'm very glad that one of our audience members posed it. We're fortunate in that the state of Virginia weeks ago began communicating with senior living organizations to discuss what would be the distribution for vaccines in the Commonwealth of Virginia. So we've already been working with the state health department, and that also includes a partnership with 2 pharmacies that the federal government contracted with to deliver the vaccine in senior living communities. Goodwin House has a partnership with CVS, and so we have CVS in our organization. So we have the Virginia Department of Health, we have the approach through the CVS and pharmacy partnership, and we intend to raise our hand and organize ourselves to be among the first to receive the vaccine. We also are preparing a communications program for our residents, our Goodwin House at Home members, our Priority Club members, and our staff about the efficacy of the vaccines that are coming on the market. So we want to make sure that they're educated about this decision and that we are, again, proactive as an organization, just as we have been with testing and other initiatives.
For you, Dr. Gloria, someone wanted to know if there's any updates regarding herd immunity.
Herd immunity remains the same, like we've discussed in previous webinars. When we talk about herd immunity, what we're really looking for is roughly 70% of a population has immunity to that particular infection. We're still nationwide at like 5%. So we've got quite a ways to go, and the vaccine will certainly help us get there.
Just going to check and see if we have any other questions coming through. Someone would like to know, regarding Goodwin House at Home, how will vaccines be handled?
Right, so this is similar to the flu vaccine. We know that many primary care physicians either provide a flu vaccine or have a relationship with some type of healthcare organization to provide the vaccine. And we think this will be the exact same way for the coronavirus vaccine. That said, we're going to do everything we can to try to be a resource to Goodwin House at Home members to obtain the COVID vaccine. Dr. Gloria, several times during the presentation, has referenced the importance of always checking with your primary care physician, because that individual is going to have your total health, if you will, dashboard and situation, and be able to advise you based on that.
Another one for you, Lindsay. Do we require staff to have the flu vaccine and eventually a COVID vaccine?
So as you can imagine, this is an important topic for an organization like Goodwin House. We have over 900 employees, and we very, very strongly urge that for their own health and safety, for the health and safety of their family members, their pod, if you will, and the residents and members that we serve, that they receive the flu vaccine. We do know that there are situations where there is some type of health uniqueness to an individual, and they need to make some type of alternative arrangements. So we have policies that we developed for these situations, whether it's a flu vaccine or whether it's a coronavirus vaccine, that we can respect what are, again, unique individual situations. However, we strongly urge our staff members, for their health, their family's health, and that of our members and our residents, to obtain the flu vaccine as we will to obtain a coronavirus vaccine.
Excellent. I think this may be the last question. Dr. Gloria, I'm going to pose this one to you. Is it true that if everyone in the country wore a mask, would we eliminate the virus in 6 weeks?
That's another good question. I don't know that that's true. All the things that we do, social distancing, using our testing protocols, wearing a mask, washing our hands, all of those things reduce our risk, absolutely, but it never takes the risk down to zero. So if you think about other infectious diseases that have happened in the past, you think about the measles, it took more than just wearing masks. Even the flu of 1918, it took more than just masks to really get it under control. And 6 weeks is a phenomenally short period of time to control a pandemic, like this. So I'm gonna have to vote not true on that one. Although a very good idea. We should all wear our masks.
All right. I think that's all the questions. So thank you, Dr. Gloria, for giving us very clear guidance on staying safe and engaged now and into the fall and winter seasons. I also want to thank Lindsay for sharing how Goodwin House has approached and responded to COVID-19 over the past 9 months. So Goodwin House at Home would also like to invite you to join us on December 8th at 1 p.m. for a Staying Home with Goodwin House at Home webinar. We have a slide on that, Katie. All right, you may want to jot that down or snap a photo. And to our listening and viewing audiences, thank you for your questions and joining us today and sending your thoughtful questions. We will send you a link to the recording of today's webinar in the next few days, so please feel free to share the information with your friends and family. We hope you all have a wonderful and safe fall and winter. Please stay safe and engaged, and feel welcome to reach out to anyone on the Goodwin House at Home or Life Plan Communities teams if we can be of support to you. And this concludes today's webinar.